Hello students, welcome to iUrage. Today we are going to discuss about the anatomy of liver. So let's get started. First we'll start with the introduction. So liver is the largest and solid gland of the body. The first point that you have to keep in mind and while writing the exam or while writing the note is that the liver is the largest and the solid gland of the body. It is surrounded by a fibrous sheath which is known as Gleason's capsule. So the liver is surrounded externally by a fibrous sheath. You'll see the external covering of the liver, the external covering which is a fibrous sheath which is known as Gleason's capsule. Next we'll see the shape of the liver. The shape of the liver is wedge shaped. So the liver is the wedge shaped organ. It is wedge shaped organ. Wedge means it is triangular in shape. That means it is broad at one end and narrow at the other end. As you can appreciate here in this picture, it is broad at one end and it is narrower at the other end. You can see it is broad at one end and it is triangular at other end or narrower at other end. So that's why it is said as wedge shaped organ, and it resembles four-sided pyramid. The liver resembles four-sided pyramid. Its color is reddish brown and its weight is 16 gram in male and 1600 gram in male and 1300 gram in females. So this is also a very important point that you have to keep in mind. So we have seen the liver is the largest and solid gland of the body surrounded by Gleason's capsule, which is also an important point that you have to keep in mind, that the liver is surrounded by a Gleason's capsule, the fibrous sheath outer covering of the liver. It is soft and very friable organ. Soft and very friable means it can easily broken into small pieces, and friable means it can easily broken into small pieces, and its shape is wedge shaped. Its color is reddish brown and its weight is 1600 gram in male and 1300 gram in females. Moving on, now we'll see the location of the liver, how where it is exactly located in the abdomen. So it is located in the right hypochondrium, greater part of the epigastrium, and extend into the hypochondrium, left hypochondrium. So in the 9 regions of abdomen, as you can appreciate here in this picture, this region is the right hypochondrium, this is the epigastrium, this region is the epigastrium, and this region is the left hypochondrium. So the liver is located in these 3 quadrants: the right hypochondrium, epigastrium, and the left hypochondrium. As it extends into the left hypochondrium, small part of liver extends into the left hypochondrium. Okay, moving on. Now we'll see the surfaces of the liver. So in all there are 5 surfaces of the liver, which is the anterior surface. Anterior surface is this surface which you are appreciating here in this picture. So this surface is the anterior surface. Then there is posterior surface. So the surface behind the anterior surface, which is present behind, is the posterior surface. Then there is superior surface, as you can appreciate here. This upper surface is the superior surface, and then there is inferior surface. So this lower part has the inferior surface, and then there is right lateral surface. So the surface which is present here, this is the right lateral surface. Okay, so in all there are 5 surfaces: the anterior, posterior, superior, inferior, and right lateral surface. Moving on, now we'll see the most prominent border of the liver. We have seen 5 surfaces of the liver, and these 5 surfaces consist of one border, which is the most prominent border of the liver, which is the inferior border. So you can appreciate here in this picture the border you are seeing here, this border is the inferior border. This border you are appreciating here is the inferior border which covers the entire liver, and it is the most prominent border of the liver. What this border exactly do, or what structure it separates? So it separates the anterior surface, it separates this anterior surface of the liver from the inferior surface. As you can appreciate here, this is the inferior surface, this is the anterior surface, and the anterior surface and the inferior surface are separated from each other by this inferior border. Okay. The next one is the right lateral surface from the inferior surface. Again here you have the right lateral surface of the liver, and this right lateral surface is separated from this inferior surface by the inferior border. So this border is very important, and it is marked by notch for ligamentum teres. I will show you in the picture. So there are two notches present on this inferior border. The first one is the notch for ligamentum teres. The notch you are appreciating here, this notch is the notch for ligamentum teres. The ligamentum teres attaches here to the inferior surface of the liver, and the notch for this attachment is present on this inferior surface. And the next one is the cystic notch. The cystic notch you are appreciating here, this notch is the cystic notch where gallbladder is attached on the inferior surface. So the notch is present on the inferior border. So there are two notches. The first one is the notch for ligamentum teres, which is this notch, and the notch for cystic notch. This is the cystic notch, and this is the notch for ligamentum teres. So these are the two most important notches you will find when you will see the inferior border of the liver. Moving on, now we will see the lobes of the liver. So there are two lobes of the liver, the right lobe and the left lobe, but the divisions of these two lobes are different according to different perspective. If we see anatomically these lobes are separated by different structures, and functionally or physiologically the two lobes get separated by different structures. First we will see the anatomical point of view, how anatomically there are presence of two lobes in the liver. So we know that there are two lobes, right and left lobe, and anatomically these right and left lobe are separated by, first one is the falciform ligament, which is present superiorly and anteriorly. Next one is the fissure for ligamentum teres and fissure for ligamentum venosum. So here if we are seeing the ligaments related to the liver, you have to keep in mind that there are two types of ligament present on the liver. The first one is the true ligament and the false ligament. True ligaments are actually the peritoneal folds which is attached to the liver, and the true ligaments consist of these ligaments, which is the right triangular ligament, which you are appreciating here in this picture, right triangular, left triangular, coronary ligament, and also falciform ligament. So for the division of right and left lobe, the ligament which plays important role is the falciform ligament, which you are appreciating here. This is the falciform ligament which is present on the anterior surface of the liver and also on the superior surface. Okay, some part of it is also present on the superior surface and majorly on the anterior surface of the liver. So by this falciform ligament, anteriorly the liver is divided into two lobes, the left lobe and the right lobe. Okay. So and the remaining two ligaments, ligamentum teres and ligamentum venosum, these ligaments are the false ligament of the liver. We have seen the true ligaments. All these present on this picture are the true ligaments, the right triangular ligament, left triangular ligament, coronary ligament, and falciform ligament. These are the true ligaments of the liver, which are the peritoneal folds attached to the liver. And if we talk about the false ligament, the false ligament are the fetal remnants. Fetal remnants are the structures that are functional during the fetal life, but they lose their function after birth, and it persists as fibrous cords or ligaments on the organs or in the body. So, the structures which are functional during the fetal life, but in the adult life or after the birth, they does not function, they just remain there or persist there as a cords or ligament. So, these two ligaments are that fetal remnants, which are also called as the false ligament of the liver. The first one is the ligamentum teres, which is present inferiorly. Okay. So, this is the area which covers two surfaces of the liver, which is the posterior and inferior. So, we will divide this area. Okay. So, by this division we get the posterior surface of the liver and the inferior surface of the liver. This is the posterior surface and this is the inferior surface. And in the posterior surface, you are appreciating here one ligament. This is the ligamentum venosum, and the fissure or the depression which is present here for the attachment of this ligament is the fissure for ligamentum venosum. And this fissure on the posterior surface and the other fissure, as you can appreciating here, this is the ligamentum teres. This ligament is the ligamentum teres, and the fissure present here, which means the depression on the liver present to attach this ligamentum teres. This ligament is the fissure for ligamentum teres, which is present on the inferior surface. So, posteriorly and inferiorly, both this fissure, that is the fissure for ligamentum venosum on the posterior surface and fissure for ligamentum teres on the inferior surface. These both ligaments separates the right and the left lobe. So, by this division we get here the left lobe of the liver and here the right lobe of the liver. Okay. So, anatomically these three structures divides the two lobes of the liver. Anteriorly by falciform ligament, which is present here anterior and on the superior surface, which divides into left and right lobe, and posteriorly and inferiorly by these two ligaments, fissure for these two ligament, which is the fissure for ligamentum venosum and fissure for ligamentum teres. So, by these ligaments we get the two lobes of the liver, right and left lobe, which is the anatomical division, but physiologically the right and left lobes are quite different. So, let us understand. Functionally or physiological point of view. So, functionally and physiologically, the division of the liver into right and left half is along the imaginary plane, which is known as the Cantillion's line. The division of right and left half is along a imaginary plane, which is known as the Cantillion's line. So, imaginary plane, this imaginary plane runs through the bed for gallbladder and the groove for inferior vena cava. You can appreciate here, this is the inferior vena cava and this is the gallbladder. So, the bed for gallbladder and the groove for inferior vena cava, the Cantillion's line runs through this. So, I draw this imaginary plane. So, it goes like this. Okay. So, this is the Cantillion's line, and these Cantillion's line divides the river into two halves, the left and the right. You can clearly appreciate here The difference between the anatomical and physiological division. See, the physiological, anatomically we have seen that these two ligament, the ligamentum fissure for ligamentum venosum and fissure for ligamentum teres divides the right and left half of the liver. But physiologically we can appreciate here that the groove for inferior vena cava and the bed for gallbladder divides the two lobes, as you can appreciate here in this picture. So by this the liver is divided into two half, and here the division is clearly based on the intrahepatic distribution of the hepatic artery as well as portal vein as well as hepatic duct. The way the hepatic artery, portal vein and hepatic duct are arranged inside the liver, based on that distribution, this division or this functional division is dependent. Okay. Uh, uh, so the arrangement of the division is such that the right lobe of the liver, is having the right hepatic artery, right branch of portal vein and hepatic duct. So this division is such the two half, when the liver is divided into two half, the right lobe is having exactly the right hepatic artery, the right branch of portal vein and the right hepatic duct, and the left lobe is having the left hepatic artery, left branch of portal vein and left hepatic duct. So this division is properly based on the intrahepatic distribution of the arteries, portal vein and duct of the liver. Okay, and the middle hepatic vein lies in this plane. Okay, so now the middle, you have to keep in mind in this picture that this is the Cantley's line which runs from the bed for gallbladder to the groove for inferior vena cava. So this is the Cantley's line which runs obliquely. Okay, here we have seen on the posterior or inferior surface, and here we are seeing on the anterior surface how this Cantley's plane runs or Cantley's line runs. So it divides, let me erase it. So this is the Cantley's line which goes obliquely and divides the liver into the left and right half. And here in this Cantley's line there is presence of the middle hepatic vein. The middle hepatic vein is exactly present or lies in this plane. Okay, the middle hepatic vein lies in this plane and the right and left lobe is having the right and left branches respectively. Now based on this Cantley's line we get the two lobes, the right and the left lobe of the liver. Now again this right and left lobe are divided into segments, which is called as the Couinaud segments, or which is called as the Couinaud's classification. Let's understand what is Couinaud's classification. So now we have the right and left lobe of the liver by the division of by the Cantley's line, which is the imaginary plane. So when we have the right and left lobe of the liver, both these lobes have four main hepatic sectors, two on the right and two on the left. So let's first understand, let's first draw the Cantley's line which goes from the gallbladder, bed for gallbladder to the groove for inferior vena cava. So this is the Cantley's line. Okay, now we have the right and left lobe. So this is the right lobe and this is the left lobe of the liver. Now here both these right and left lobe are again divided into two parts each. So the right divides into the anterior and posterior. So it is divided into two parts. The first one is the anterior and behind, which is present behind, is the posterior. and the left lobe is dividing into the left lateral and left medial segments. So, we are dividing it, and these left lateral and left medial segments on the left lobe is divided by the falciform ligament. You can clearly see the difference that when we are discussing about the anatomical division, the falciform ligament are used to divide the two lobes, right and left lobe. But here in the functional division, the falciform ligament is used to differentiate or to divide the left lobe only into two different segments. So, this is the falciform ligament, and by this falciform ligament we get the two segments of the left lobe, the left lateral and left medial segment. This is the left medial segment. Okay, we get the left lateral and left medial segment here by the falciform ligament. So, here you are getting four segments, two on each lobe. Right one, on the right one we get the right anterior and right posterior. On the left lobe we get the left lateral sector and left medial sector, which is also known as the quadrate lobe. Here there is a presence of a lobe which is the quadrate lobe, and this quadrate lobe is known as the left medial segment. What exactly is the quadrate lobe and what are the boundaries of this quadrate lobe, we will discuss in the next lecture. So, here just have to keep in mind that right and left lobes are divided into two segment each, the right into right anterior and posterior, and the left into the left lateral and left medial, and the left lobe is divided by the falciform ligament. Again, important point. Okay. Now, after this division, both this lobe or all the four segments of this lobe are again divides into two parts. So, all these four segments again divides into two parts. So, in all we get the total 8 segments of the liver, which is known as the Couinaud segments, which are total 8 in number. Let us understand what are these 8 segments. Now, the Couinaud segments. So, we have seen that the right and the left lobe is divided into two segments each, right anterior and right posterior, left lateral and left medial. Now, all these segments are again divided into two parts. So, in all we get the 8 segments. So, 4 on the right and 4 on the left. Okay, as you can appreciate here in this picture. So, here segment 1, 2, 3 and 4 are of left lobe, as you can appreciate here in this picture. Segment 1, segment 2, segment 3 and segment 4. 4 of these segments are a part of left lobe, and segment 5, 6, 7 and 8 are the parts of right lobe. You can appreciate here, this is the 5th segment, this is the 6th segment, 7th and 8th. These segments are the part of the right lobe. Okay. But here important thing that you have to keep in mind is that the segment 1, let me erase this so you can understand it better. So, you can appreciate here the segment 1. So, this segment 1 is actually the caudate lobe of the liver. What is exactly the caudate lobe we will discuss in the next lecture. We have come across two terms, quadrate lobe and caudate lobe. Both these lobes are very important and we will discuss it in the next lecture. But right for now you have to keep in mind that the segment 1 is actually the caudate lobe of the liver, which is present on the posterior surface. So, it has an independent supply from both the right and left portal vein and hepatic artery. So, in the previous slide we have seen that the right lobe and the left lobe of the liver, gets its supply from the right and left branches respectively, from the right hepatic branch, right portal vein and right hepatic duct, and the left lobe has left hepatic artery, left portal vein and left hepatic duct. But in case of segment 1, it has an independent supply. The segment 1 does not get, as it is a part of the left lobe, but it does not only get supply from the left branches of the blood vessels, it gets the supply from both of the lobes or both of the sides, from the right branches and as well as from the left branches. That is why this lobe particularly has an independent blood supply, and its hepatic vein directly joins the inferior vena cava. The hepatic vein of this segment, which is a part of the left lobe, but still its hepatic vein directly joins the inferior vena cava, as you can appreciate here also in this picture, that the hepatic vein of the first segment directly joins the inferior vena cava, and the only segment which gets the supply from both of the branches or both of the blood supply of both the lobes. Okay, so these are the points that you have to keep in mind regarding the segment 1, that it is the quadrate lobe. The second name for the segment 1 is that it is the quadrate lobe, which is present on the posterior surface. It has an independent supply as it gets the blood supply from both right and left branches, and its hepatic vein drains directly into the inferior vena cava. And the next point you have to keep in mind is that the segment 4, about the segment 4, as you can appreciate here, this is the segment 4. The segment 4 is recognized as the quadrate lobe or left medial segment. We have seen what is left lateral and left medial segments. So, as we know that let me erase this. Okay. So, as we know that the left lobe is divided into left medial and left lateral segment. So, in the left medial segment, the fourth lobe or fourth segment is located, and this fourth segment is actually the quadrate lobe of the liver. This is the quadrate lobe of the liver, which is present on the inferior surface of the liver, and the segment 1 is the caudate lobe of the liver, which is on the posterior surface of the liver. Okay, what exactly are these caudate and quadrate lobe we will discuss in the next lecture. But for now, you have to keep in mind that the segment 1 is the part of the caudate lobe, or it is itself a caudate lobe, and segment 4 is the quadrate lobe of the liver, which is also called as the left medial segment. Okay, so here let us understand again the exact functional division of the liver. So, the liver is functionally divided by the intrahepatic distributions of the hepatic artery, portal vein and hepatic duct. So, based on these branches, the liver is divided into two lobes by a Cantley's line, which is present obliquely. So, let us assume or let us draw the imaginary Cantley's line. So, suppose this is here present a gallbladder. So, we will draw a oblique line which divides the liver into right and left lobe. Then again the right and left lobe divides into two branches each, two segments each, the anterior segment and the posterior segment, and the left lateral segment and the left medial segment. Then again this segment divides into two parts, and totally we get the 4 parts or 4 segments on the right lobe and 4 segments on the left lobe. But here the difference or the important point that we have to keep in mind is regarding the segment 1, which is present on the left lobe, but it has an independent blood supply. It gets the supply from both the branches, and it is the caudate lobe of the liver. And regarding the segment 4, that it is recognized as the quadrate lobe of the liver. So, that is all for today's lecture. In the next lecture, we'll discuss the remaining points of the anatomy of liver. Until then, keep reading and don't forget to subscribe, like and share. Thank you for watching this video.